This is Dr. Steve. Feel inspired.
This show is going to change your life.
Feel connected. Feel better.
Feel better is not just a slogan for the show. It's actually a challenge, a mission, and a promise from me to you to help you live a healthier life.
This is Dr. Steve.
Hi, I'm Dr. Steve Salvatore. Thanks so much for joining me today. We're going to feel a lot better and be a whole lot smarter after today's show. Up front, a lot of us have become pretty casual about how we carry around our cell phones. For women, there is one place in particular that you don't want to stash it. And joining me now is Dr. Devra Davis from the nonprofit group Environmental Health Trust. Dr. Davis, good to see you.
Thanks for having me.
So where are women putting their cell phone that they shouldn't be putting it?
A large number of young women are putting the phone right in the center of their chest. And that's not really a good idea. In fact, the phones come with warnings not to do that.
So meaning basically they're stuffing it in their bra to carry them around?
Well, and to work out. And we actually have, unfortunately, several cases of young women who've developed breast cancer as a result of keeping the phone in their bra for hours a day.
So you actually have seen cases of young women then developing breast cancer. They don't have a family history or anything like that. You've been able to trace it to the cell phone.
We actually have at this point 6 cases of young women with no family history, with no genetic risk factors for the disease, and 2 of them are age 21, and the only thing that they did that could have caused this disease is they kept the phone right in the center of their chest. As you know, breast cancer normally forms in the upper outer quadrant. These tumors are very unusual in 2 ways. First of all, the cases are very, very young, and secondly, where the tumors have formed, there are more than one of them, and they're right under the outline where the cell phone was kept.
Wow, there's no denying that. So has there been also some research linking the radiation from cell phones to breast cancer? Is there a lot of data on that?
There's not a lot of data because we in the United States have not done a lot of research, but in fact studies have been done in Turkey and published that have looked at breast cancer cells and have found that when you expose them to cell phone radiation experimentally, you can quadruple their growth.
Wow. So you mentioned that there's a warning on cell phones. Tell me about that. Where could people find those warnings? Or basically, what is the warning that it says?
Well, if you go to our website, the warnings are there. If you go to your iPhone and you click on General, About, Legal, and then RF exposure, in the phone itself, it tells you to use a headset or a speakerphone when you're using the phone, and to keep the phone at least 10 millimeters away from the body.
Right. So that's a little bit of a problem because we know we tuck it in, women tuck it in their breasts, in their bra, but what about, in your front pocket?
Well, for young men, we're very much aware of this. BlackBerry, as well as other smartphones, say don't keep it in the pocket. Keep the phone at least 2.54 centimeters away from the abdomen of the pregnant woman or teenagers. And men who want to become fathers have to be aware of something. If you take sperm from healthy men and you put them in 2 test tubes, one test tube gets exposed to cell phone radiation and the other does not, the test tube exposed to cell phone radiation dies 3 times faster, and the sperm have 3 times more damage to their DNA.
So this is not there's no question about this anymore. People were saying, oh, that was the older cell phones, the newer cell phones don't have this problem. But this is definitely a problem that we've seen with research and we're seeing it now with people.
Exactly, and in fact, there's growing consensus in the medical community. Professor Stan Glantz at the University of California published Biostatistics in Medicine and said that as far as he's concerned, the evidence is clear. Cell phones can't be a form of birth control for men, but they clearly damage sperm.
Okay, now I can't let you go without talking about the Nobel Prize that you shared with Al Gore. Tell me about that.
Well, I was a member of a team of several hundred scientists who worked for many years looking at all of the data on, in my case, public health impacts of climate and fossil fuels in particular, and we concluded that you could save millions of lives by reducing our dependency on coal and cleaning up the environment, something that we still need to work on.
So you have so many projects you're working on. Just want to wrap up where people can get more information about this radiation breast cancer stuff. You have a website. Tell me about that.
We certainly do. It's Environmental Health Trust, or ehtrust.org. We have a Facebook page as well, and you can reach us on Twitter at ehtrust. And we're working with people. We're delighted to talk to you, Dr. Steve,
all right,
because you're doing a good job here letting know people that they can practice safe phone, and we want to save the girls, which is our hashtag. You can pull down our banner from our website.
All right, save the girls. Dr. Devra Davis, thanks so much for coming in. Really appreciate it.
It was a pleasure.
Good to see you.